Hello there again and welcome. Good afternoon. Thank you for joining us on SOUQ News Television once again. This is Development Weekly, where we touch on salient issues bordering on developmental and economic growth. It also showcases humanitarian and sustainable development activities by relevant stakeholders, highlighting their impact on socio-economic development. Today on the program, we discuss healthcare outcomes in Nigeria and the ways to improve them. In a nation where access to quality healthcare remains a challenge and conversations regarding policymakers' efforts to transform the landscape still linger, it's important to have said discussions across the borders. From rural communities to urban centers, Nigeria's healthcare system faces numerous obstacles. Limited resources, inadequate infrastructure, and disparities in healthcare delivery has continued to hinder development, as it were. Amidst these challenges, stories of resilience, determination, and innovation abound in areas such as maternal and child mortality, infectious disease management, non-communicable disease prevention, healthcare financing, and accessibility, as well as technology-driven healthcare solutions. On the program today, we discuss these issues and more, talking about Nigeria's healthcare ecosystem, as well as identify opportunities for growth and improvement. I am David Chiedu, and joining us on the program this afternoon is the chairman of the Public Health Sustainable Advocacy Initiative, Mr. Ayo Adebusoye. Good afternoon, Mr. Adebusoye. Thank you for joining us. Can you hear me?
Yes, I can hear you loud and clear.
Yes, thank you for joining us once again. So, Mr. Adebusoye, give us your thoughts. Now, let's start on this note with your thoughts, first of all, on how we have fared with regards to, healthcare in the country. That's the country's healthcare ecosystem so far. What are your thoughts regarding it?
Well, I think it's something which is well known that Nigeria we have one of the lowest performance with regards to health outcomes. Uh, some statistics is talking about we're like ranked 187, out of 195. So we we have about 615 maternal mortality ratio for every 100,000 live birth. Those are, the proxies by which we can measure our health outcomes. 70% of our health spend is out of pocket. So these are indicators to show that there is a lot that needs to be uh, improved upon in Nigeria. We have over 200 million population. We're not really fully sure now. And to give you a context, at independence, 1960, Nigeria was just about 45 million, and our uh, colonial power, United Kingdom, so 54 million. And then take that 60 years ahead, today, the United Kingdom is just about 65 million or thereabouts, and Nigeria is over 200 million. We're not even really sure of our population. So that should let you know that there's so many issues which are going on. Nigerians now, statistics are showing that 80% of Nigerians are living under the poverty level, Human Development Index. So the challenges are huge, but the opportunities are also there if we have the political will. And I keep on quoting one local government chairman years ago who told me that, quote and unquote, quote, health is not a campaignable issue, unquote. And that's the uh, real root of the problem with regards to the efforts from policymakers in health. It is not given that priority, which health has to be given. Um, in Abuja in the year 2000, we always quote this: African Union countries from all over Africa came together for the African Union meeting in Abuja, coincidentally, and they agreed that 15% of the budget for every country in Nigeria would be allocated to health. However, since that date, Nigeria has never come anywhere close to 15% in regards to its health spend, its health budget as out of the share of the total budget. In fact, we're normally around 5%. Um, And this is part of why we see what is going on. The fact that, one, there's even not the commensurate budget allocation. And even that one that is allocated, how much is even being spent? Because there's a difference between the budget allocation and even the budget utilization. At the end of the day, we see that in the health sector, especially, a lot of funds are still not spent at the end of the year for various reasons, the procurement process, delayed releases, etc. And of course, when we speak about Nigeria, it's not just the federal government, also the sub-national level. And this is something which, unless we tackle this head on, we're going to continue to face the challenges which we see coming around us. Um, One of the things the government has to do, and nobody else can do it except government, is to prioritize and stop looking at health as an expenditure, but as an investment. The World Bank has actually come out clear to show that, unlike what they had been preaching in the past decades, they've discovered that countries that spend on human capital development, i.e., health, education especially, once countries that spend on that, they see a commensurate economic growth. Happens across the board. The Asian tigers you see, Malaysia, Singapore, they are developed now because of the heavy investment expenditure in health. So this is something which our Nigerian political leaders, policymakers at the federal, state, and local governments have to come to grips with. That health must be prioritized. That is the first thing. Thank you.
Right. Now, you've mentioned a few of the challenges, including budgetary allocations, which we're going to get to during the course of the conversation. But let's talk about something symmetrical to what we're talking about now, and even more specific, as it were. PHC, I like to call it that. That's primary healthcare in Nigeria. So far, the jury is still out on, the progress that we've made in that regard. What do you make of this aspect of health with regards to accessibility and all its appurtenances?
Well, I'm not even sure if the jury is even out. I think they decided long ago that primary healthcare system is in need of a complete infusion of emergency treatment. In fact, the point have come up clearly many times that we need to have declared a state of emergency. We have the National Health Act 2014, but we saw how long it's taken for even full on implementation. There are some fundamentals that are needed. And of course, the previous administration has spoken about 100,000 PHCs or PHC in every ward, etc. Those that are even there, only 20% of the primary healthcare facilities in Nigeria provide 24-hour service for starters. So how much can they get? And 30% of PHCs facilities, primary healthcare facilities, lack basic equipment and supplies. So these are some fundamental issues that the government has to tackle head on with regards to primary health care. There are some legislation policies that have brought up the primary health care to the forefront, like National Health Fund. That's why we have the Basic Healthcare Provision Fund, which is supposed to support the whole primary health care ecosystem, including the health insurance aspect and even the primary healthcare facilities themselves, and of course, some emergency expenditure, health expenditure. However, even the basic healthcare provision fund has not been coming out regularly. Like that was the last time there has been a release from the federal government to the states. There's always a delay. There's always a challenge getting it out. It took a long time to 2014 to even get the process going. And even now that finally they even got it as the first child, there's delay getting the basic healthcare provision fund out. So I think again boils down to us getting the political will together, not just the federal government. Now, the primary health care facilities are actually a prime responsibility, constitutional responsibility of the local government. So, thank God, there is now the local government autonomy, which the Supreme Court has empowered. And this is the time that all citizens of Nigeria must demand their local governments to begin to prioritize the health spend. At least let them even put 15% of their local government budget into health in accordance with the Abuja Declaration. That's a step towards the primary health care facility. We see that in all the local governments, there's supposed to be a local government health authority as prescribed by the National Health Act. How many are functional? There's supposed to be the ward development committees or ward health committees. How many are in place? These are things that need to be placed because with community participation, you can actually get the primary health care going. We know of some communities where the ward health committees are very vibrant, that they even can even help build facilities, help to maintain facilities, help to support facilities with funding. Once you can get the community involved, very, very critical. So I think the primary health care facility is something which has to prioritize because that is the first port of call, supposed to be for most people. But in a situation where only 20% of private healthcare facilities have 24-hour service, imagine the challenge where you go there, there's hardly any equipment, any treatment, any medicine, any drugs. Maybe they just come from vaccination, immunization occasionally. This is why persons have challenges even accessing. There's a challenge with regards to accessing basic health care. So the PHC are key to any health developments in Nigeria. Okay.
So these challenges, I want us to go even further. That's challenges with regards to accessing PHC in the country. There's only about 60%, from some stats that have been released, 60% of Nigerians that can access primary healthcare services. Not very encouraging figures, that one. What would you say are, or have been, the primary factors responsible for these individuals that accrue to that particular percentage being unable to access PHC? You mentioned the local government. Of course, we know what's happening with the local government these days and, the legislation in their favor. Compare, contrast to what's happening also still on the subnational level, the executives in the states. So, I reckon there is a disconnect somewhere because if there isn't, that number wouldn't be the way that it is, and there will be more people being able to access primary healthcare. So, Mr. Adebusoye, can you help us get a sense of why it's been this way? Some of the factors responsible.
Yeah, one, geographic barriers. 70% of the healthcare facilities in the country are located in the urban areas. So the rural areas are, underserved. And of course, we have the majority of our population in the rural areas. And, so challenge A, how do they even physically access a healthcare facility when it's miles and miles away? Some of our people are living in the river. How do they access it? They can only cross the river, the lagoon, to get to where the healthcare facility is. Another one is financial barrier. As we mentioned, 70 to 80% of our healthcare spend is out of pocket. Many people, that makes healthcare unaffordable for many Nigerians. 1,000 naira, 1,000 naira in a life and death situation. And if you don't have it, you may not be able to access care because as soon as at the point of delivery, at the point of service delivery, they're asking for money, which is the most inefficient way of having a health system in place. Those are the things. So those things have to be looked at carefully. The geographic barrier and the financial barrier. Those are huge, huge ones that can only, it is a sustained focus and investment for it to come out of it. Part of it would be one, first, as I mentioned earlier, both the federal, state, and local governments to increase their investment in health. We have all committed to 15%. It was happening in Abuja. Let's start going towards that. This 5% at the federal level and below 10% for most states doesn't cut it. And that's why we have what we have. And apart from the budget allocation, there has to be effective releases of funds, not just to have it on paper. We must very quickly, in accordance with the National Health Insurance Authority Act 2022, which makes it compulsory for every resident of Nigeria to be under some health coverage. We must very quickly migrate all Nigerians into a health plan, a health insurance plan, the national, the states, or a private health plan. The state health plans are supposed to be social health insurance, so government is supposed to make sure that it is at the most lowest cost possible The whole idea of of any insurance is that you pool funds together so that with a little funding, just like in Lagos State, it's about 11,000 now to access. They have a year's coverage of the basic what they call Ilera Eco, that is the social health insurance in Lagos State. And with that, imagine if you have like Lagos, we have about 20 million, almost 30 million souls in Lagos, maybe about 6 million, could be those who actually pay to cover, because one person could pay for 4 people, 6 people. Imagine if we have that pool of funds that comes in would be able to guarantee affordable, quality, accessible healthcare for all at the subnational level. So that's what we really need to begin to push very clearly. Because the good thing about the health insurance is that it finances the funds follow lives. So as opposed to the situation which we experienced many years ago, when we were monitoring and evaluating the MDGs program grants by the Office of the Senior Special Assistant to the President. And we discovered that there are some places that private healthcare facilities were built and nobody was accessing care because it was just built with a political objective in mind. Maybe somebody's a senator or a House of Rep person there says put it there. There was no need for it. So it was built at that time. 3 billion was the cost for each primary healthcare facility wherever it was situated in Nigeria, which is also not a realistic figure because how can you have in the swamp and in the savannah the same kind of building? But 3 billion then. So we had some situations then we discovered where in the world you have 2 primary healthcare facilities which are not needed, and in some other places they don't have no primary healthcare facility. And so when they want to distribute, especially from the federal level, distribute maybe mosquito nets, drugs, something, there's even no health facility there. So they'll have to keep the drugs in the traditional ruler's place until many times they expire. So all these challenges in logistics and planning also want to make our primary healthcare outcomes still very, very poor. As we mentioned, the high maternal mortality rate we have in the country, one of the highest in the world. So one of the things we need to do, the good thing about the health insurance, if we all get behind it, starting with the political policy makers who have the duty bearers, state governments, especially because the National Health Insurance Act is working through the state health insurance agencies. If they can do that, get behind it properly, understand the priority of health, then when there's funding to the facilities, part of the premium covers capitation, which means that will go to the facility calculated on the number of patients enrolled there, even if they don't access. Because most people who do insurance, just like vehicle insurance, most people don't have to, they make claims on their vehicle for years. Many times they may not never make claims, but the law says you must make sure you license your vehicle, get it insured. Same way with your life. Our lives are more important. So if everybody does that, then you'll see that a lot of funds will go to the health facilities that will take care of their, even health workers needs, take care of basic equipment, upgrading, renovating of the facility. That is how, if we can push that, we can actually see from the private sector, because the good thing about health insurance is that it brings in funds not just from the public, the government, but also from the private sector. They will fund, support the health infrastructure at the primary healthcare levels if we push the health insurance schemes, because that will push the capitation financing that will follow the enrollees, the lives, persons who actually enrolled there. So this is key to solving this problem of getting financing for our primary health care. Thank you.
All right, we're going to continue from here very shortly on the program, Mr. Adebusoye, but not before we take a very short break. In case you're just tuning in, this is Development Weekly on SOUQ News Television, and we're talking about improving healthcare outcomes in Nigeria. Take a short break. When we come back, more conversations on the program. Stay with us. Welcome back to Development Weekly on SOUQ News Television. We're still talking about improving healthcare outcomes in the country. And our guest so far has been Mr. Ayo Adebusoye. He's the chairman of Public Health Sustainability or Sustainable Advocacy Initiative, and of course a board member, Lagos State Health Management Agency. And he's been giving us his thoughts so far with regards to the issues plaguing the health sector in the countries, and we're still talking about ways to get around them. Mr. Adebusoye, now let's take our thoughts to productivity, taking cognizance of the country's fiscal sector right now and how not so promising so far it's looked in the last year or thereabout. There have been some arguments that, considering how many facilities there are, especially in the health sector and the education sector, but we're talking about the healthcare sector right now, across the board, there are innumerable facilities that are, just as you mentioned, some of them, you mentioned a particular percentage, 20% of them, if I remember correctly, that are not particularly providing the services for which they were built to provide. So the argument has been, is it possible, before I get on with my question, just to give some more context to the conversation, a total number of facilities are estimated to be about 40,000 across the country. It's broken down into about 34,674 PHCs, which are mainly provided by the private sector. Then, of course, 5,780 second care facilities, 166 tertiary care facilities, as you will. All these are estimates, and it's across the board. So the conversation or the suggestions by some stakeholder, considering our fiscal challenges, have been to have the federal government divest some of these facilities that are not providing the services for which they are, they were created for. Either that, or work more with the private sector to bring in, fresh investments per se, that would help contribute more by way of GDP to the federal government. Because what we have right now is just, hovering somewhere around 0.75%. That's 0.75%, which is nothing, more or less. So what are your thoughts regarding all of this, Mr. Adebusoye?
I think it's important for us to realize that something is even happening already. And one of it is that there's some private sector initiatives happening, which is even bringing in some medical tourism, or it's aimed towards bringing in medical tourism back. But that's usually for the high end. And it's something which will be quite pricey for the average Nigerian, but at least it's a start. We see some of the new, very, very high quality hospitals, and of course, high cost hospitals, which are coming up in the country. And the whole idea is so that there could be some reverse medical tourism happening, investment in that sector. But what government has to encourage is a PPP model where they could, and this is where the health insurance scheme at the subnational level can take a lead. Because, for instance, in the Lagos State, under the Lagos Health Management Agency law, the section 27, where it empowers the health fund. There's supposed to be a health fund, Lagos Health Fund, which also comprises of funds both from government equity fund and also from private sector, development partners, various sources, so that there will be a pool. The whole strength of the health insurance in social health insurance schemes is that there should be a pool of resources which will be able to drive purchases, strategic purchases, even of drugs, because when you have a huge pool, you can actually even purchase drugs at a more cheaper level, be able to drive equipping the facilities. So I think it's something which the government now has to, again, boils down to prioritization. Prioritizing the PPP initiatives in the health sector, ensure that there can even be R&D to support research and development, which is something which we have not been doing. We saw at the last COVID that we were completely dependent on foreign resources to bring in the COVID vaccine. It was only South Africa that managed to, again, make a lot of good strides in doing some research and ultimately getting the whole COVID vaccine up and running. So Nigeria, for instance, now there's a malaria vaccine that has just been introduced, but it's coming from outside externally. No country can stand health-wise if we're dependent on foreign largesse, foreign generosity, foreign compassion for our basic health needs. It's not going to work. So for a long time, we have been dependent on foreign, generosity, foreign aid for our health sector, critical health things like malaria, global fund, HIV. These are all things which we should take care of as a polio. This was because of international support we managed to at least eradicate the polio in Nigeria. So we must begin to move to areas where we can begin to finance research and development in the universities, in the health institutions, hospitals, research institutions, and link them with the private sector. Because that's how it's done. Private sector can support such. It's not just government alone, but the government has to make that environment, the regulatory environment, the tax incentives, various things to ensure that that happens. We cannot continue indefinitely. It's not sustainable where we're dependent on importing our drugs. That's what is happening now. And we see with the cost mentioned now, economy, now we see the astronomical rise in the prices of drugs because we're importing them. We must make them. We have so many, in our space. The herbal aspect is there, but we need to make sure that they become up to speed with enough research to make sure that they can stand all the tests which are necessary before they can actually start to produce these things properly. Nigeria has it all, but it needs to that coordination to get both those who are in the academia, private sector funding together. And that's what government has to do to make sure that happens. We cannot continue on this trajectory where we're importing. Now, we import everything, our family planning commodities, importing them. Our HIV, retroviral drugs, importing them. Malaria tablets even, and we're one of the #1 malaria exports in the world, we're importing them. Which one are we doing then? We must begin to turn the mindset around. Like you said, productivity. We have the scientists, we have top medical scientists, top grade. But if you don't support them, research takes time. It's not a matter of, like a trading thing you put in today and you get. And that's one thing the government has to back. Then you'll see the long-term results. And we'll see it happens everywhere.
Mr. Adebusoye, pardon me to interrupt your thoughts a little bit. Following your remarks, you talked about research, and I want to, piggyback off of that. Do we have a research issue, or a leadership issue, as it were? And I asked that question quite deliberately because as far as our healthcare system is concerned, we focus more on curative care, which is dysfunctional and sort of kind of ill-prepared when you talk about or when you consider the preponderance or the emergence of more non-communicable diseases in the country, and the surge in death due to metabolic risks, as it were. Is this really a research problem, or is it something else?
It's a mix. For instance, now most of the main diseases these days globally are zoomorphic in nature, coming from the animal kingdom, mingling with us. The COVID, mad cow disease, Ebola, we have also many that are coming every time. Monkeypox coming up even here. They're all coming, and it's going to continue increasing. So if we don't put together the brains, the funding, because it's not going to happen by itself, to look into all the areas that these vectors are coming, into our space, and we're just dependent every time, repeatedly, on what the foreign people are doing, it's not going to work. It's definitely not sustainable. So it's a whole mix of things where we ourselves have to begin to preempt things that happen, just like they happened then. Some people say, "Oh, COVID, how did they get the vaccines out?" They had anticipated it. They had been working. There was, for part of the allegation is that one of the places they were working, Wuhan lab in China, is one of those kind of places where they were doing those kind of researches with so-called gain of function, things that they were doing to those, viruses, which would even make it. So there was a suspect allegation that maybe it leaked. So it is very important for us to begin to look into the aspect of bioresearch, in biomedical research in Nigeria, and support it with funds. It's not going to happen. It's not a free thing. It won't just happen by itself. We spend so much money on frivolities, but these are areas, and we have a comparative advantage because we have the brains, medical brains. We're good globally. Nigerians are doing very well in the medical field. So it's not that we can't do it, but this thing needs coordination. It won't just happen by itself. We have institutions here. We have the Nigerian Institute of Medical Research. It should be funded. They should be supported, not just government alone, but with private sector. But the private sector will only fund if there is an enabling environment, a regulatory framework for this thing to be done properly. So it's not something that is optional. It's something that we have to do. Whether we do it now, we do it 10 years time, 20 years time, it's going to have to be done. We have to support research and development of the healthcare system. We have to do it both preventive, curative. It's got to be done. That's the main thing. And so let us
All
start
right.
the process.
Okay. Because of time, Mr. Ayo, let me also throw this in very quickly. Earlier, you spoke about health insurance, which is critical. As a matter of fact, there's been legislation about it or legislation for it, and then that particular piece of legislation has been reviewed in recent time. As a matter of fact, to accommodate or to include more, Nigerians, as you were. Now, with regards to that, you and I can agree that there is still a dearth of information, with regards to, people knowing more what they need to know with regards to this particular issue. Now, let's talk about advocacy. What more needs to be done, and how do we go about doing it to make sure that more Nigerians are adequately and sufficiently aware about the tenets of health insurance and how critical it is?
Yeah. Well, one of it is like what we're doing now, speaking on TV, very, very critical, and on radio. And this is at the subnational levels, because this thing is going to be driven at the subnational levels, the state and local government level. It's not federal. And this was why for years that they've had the NHIS previously, National Health Insurance Scheme. It's about 5% of the population who had coverage on health insurance. This has to be driven by the states, just as they drive immunization campaigns massively. It has to be driven by the states, billboards, radio, social media, TV, everywhere. In all the schools, there has to be hinged. There has to also be some enforcement, but awareness creation first, where you must show you, just like before you drive your car, you can't drive your car in Nigeria without having vehicle insurance. You can't. A third-party insurance, at least. So the same way, once there's huge advocacy, huge awareness, ease up with the enforcement, start slowly, gradually. For your child to be registered, there must be an insurance coverage so that if anything happens in school, he'll be covered. So like that, those things, that's how to make it happen. Actually, but there has to be that massive, media blitz, constant campaign that this thing is on. There's an act backing it, and every resident of Nigeria, not even say every resident of Nigeria, must be insured. Every employer must make sure that their employees, both private and public, have some health insurance coverage. And this is something that has to just be a constant, sustained drive. It's not going to happen just one day, but that sustainability is there. And while that is going on, the government must have their own investments to make sure that when persons get to the clinics, the facilities, of course, both public and private health insurance, both public and private, but they must make sure that the facilities have some basic minimum package of care for the patients. We must make sure that the health workers are there and that they're willing to actually do the work, competent to do the work, not driving patients away. Because part of the reason why we see in many places they go to the traditional health attendant because there is some care, some personal touch. But in many of, especially the public sector hospitals, facilities, where they are maybe overworked and many may feel underpaid. Let's see for the attitude, because that's one of the main studies that drives patients away. Health workers, staff attitude. So I think it's something which needs all hands on deck. Huge blitz with regards to the media for everyone to know that this is something which is now a law in the whole country and we must all get behind it. Thank you.
As we round up, Mr. Adebusoye, in a few words, can you prefer some solutions? You are a stakeholder in the sector, and I reckon that there are some critical decisions that you feel that the authorities or the executives, as you were, need to take to make sure that we fast track better outcomes, as you were, in the health sector. Now, in your view, seeing as we're in the age of technology, everything is technology driven and most AI driven, as you were, what would you say should be what we need to adopt by way of innovative technology-driven healthcare solutions that can, help us build better healthcare management systems?
Yeah, the short term, the first thing is, as I mentioned, that there must be the political will. That one does not even need technology. It just needs for us to really understand that, just like look at COVID. During COVID, everything stopped. Nobody was going to work except the health sector. That shows the primary place that health has in our whole system. So increase funding in healthcare. Recognize that this is not an expenditure, it's an investment for the good of this generation and the next generation. Improve infrastructure and equipment in the facilities so that when people go there, they have something. It's not that they go there, there's no equipment. They must train, and deploy more health workers. Now, because of the global situation, there's a brain drain, especially with regards to healthcare workers. Of course, in other sectors as well, but especially health workers, a hot cake, our Nigerian, to show that the training we get is good. They like them abroad. So we must make sure that the conditions of employment of our healthcare workers are standard. Decouple them, we've said this before, decouple them from the normal civil service, especially for the public sector. And we pay them per hour. Make it so lucrative for them that they can work in different places and get paid. Not just the civil service structure, just stay here and only have to work here. You want to work in multiple places and get paid per hour. Increase their rates. Acknowledge that this is a peculiar profession that needs those kind of rates. Make sure that they have access, easy access to mortgages, for housing, for transport, schooling. These are some things that will encourage the retention of health workers there. And in longer term, make sure, as we said, implement the universal healthcare coverage through mandatory health insurance scheme at the subnational level, promote public-private partnerships to ensure that they can actually build proper facilities, well-equipped facilities, not just waiting for government. Strengthen the PHCs through community engagements and participation. I mentioned it earlier. We know some World Health Committees that sustain, maintain many health facilities because they have been acknowledged in the National Health Act 2014. Bring them, and of course, like you said, leverage technology for healthcare delivery and management. In Lagos, we had the online system, virtual system, since the time of COVID, where people can actually connect and get some counseling online. We have to start things like that. If we launch a virtual booth in Lagos State, we need to look at that model, see how we can go further with that. So that some places where you can even not have a full-blown health with health facilities, you have a virtual booth, health booth, where they can come in and get counsel, some access of care virtually at that place, because technology can do that. So these are all things that can only happen, one, if there is a political will. It comes down to that, first and foremost. Thank you.
All right, thank you very much, Mr. Ayo Adebusoye for joining us on the program this morning. Mr. Adebusoye is the chairman of Public Health Sustainable Advocacy Initiative, PHSAI, and the board member, Lagos State Health Management Agency. Many thanks, Mr. Ayo, for joining us again on the program today.
Thank you very much. Thank you very much. Thank you. God bless.
And that's Development Weekly. But a recap very quickly. We've been talking about improving healthcare outcomes in Nigeria, transforming the healthcare landscape or ecosystem, if you like. And we've talked about the issues, talked about the challenges. But amidst all the challenges and issues that there are, ways to circumvent these challenges or ways to better our lot seems to be the critical question, or seems to be the critical issue, as it were. Of course, some solutions and recommendations have been preferred from the point of view of our guest this afternoon. He's talked about funding, making specific reference to the budget. Has talked about strengthening primary healthcare centers, which are indeed very, very pivotal to healthcare delivery at the subnational level. And of course, he has talked about healthcare insurance and strengthening advocacy in that regard, promoting that even more. He's talked about research, more of it. He's talked about the creation of stronger systems and infrastructure, as well as training, and more training. And above all else, he harps on the political will, which so far has been lacking. So hopefully, if these are put in place, we would have better showing as far as our healthcare system in the country is concerned, and the much needed transformation will be achieved. That is Development Weekly. Today on the program, do keep a date with us, same time next Thursday, talking about 1 p.m. I am David Chiedu. Stay tuned to SOUQ News Television for more great programming, and of course the news on the hour at 3 p.m. later on. Do have a pleasant day.